Bismillahirrahmanirrahim. I am Dr. Muhammad Ilyas, Assistant Professor in Medical Laboratory Technology, Rifa International University, Malacca campus. We have started a series of lectures on histotechniques. So, this is the first lecture in which we will introduce the histotechniques. So, first of all, we will have some basic definitions to start with. As you know, histology is the branch of medical science in which we study the normal tissue under microscope, while histopathology is the branch of medical science in which we study the diseased or morbid tissue under the microscope. Now, what is histotechnique? Sometimes also known as microtechnique. So, it is a set of techniques which are used in order to prepare a final stain slide from a tissue, that may be biopsy, that may be autopsy. These are some of the basic terminologies which is used in the histotechnique and histopathology as well. So first is the biopsy or autopsy. So biopsy is any tissue which is surgically removed from a living organism, or autopsy is a piece of tissue or tissue which is surgically removed from a dead body. So this biopsy and autopsy is further classified into incisional biopsy and excisional biopsy based on the size of the biopsy. If we have a small size of biopsy like a part of the tumor or lesion, it is known as incisional biopsy, while if the size of the tissue is large, like whole tumor or whole tissue or whole organ is surgically removed, then this type of the biopsy is known as excisional biopsy. So in the introduction, we will discuss the protocols that is followed in the histopathology or histotechnique. So the first is reception and identification. So this is where we receive the tissue in the laboratory and we'll process it on the reception. So this must include the patient information and history, and along with that a description of the site of origin of the tissue from the body. Then we will label the specimen, that is the biopsy, and we will provide a proper laboratory number to the biopsy. Nowadays this number is replaced by the QR code or a barcode that can be scanned, so we will not miss the biopsy. After this process, we will examine the tissue macroscopically, which is known as the gross examination, in which we will measure the size, in which length, width, and depth, and consistency, appearance, discoloration, any type of the apparent abnormalities which is present in the tissue. So we note all of these in the gross examination. Then continuation of fixation. Here the term continuation is used because biopsy is usually fixed from the operation theater. So the fixation process must be started from the OT or operation theater, and then we will change the fixatio and provide a fixatio of proper concentration. So this is known as continuation of fixation, not the start of fixation. Then if we have a bony biopsy or hard biopsy, that is also known as calcified biopsy. So we can have a physiologically calcified biopsy like bone, and we can have pathological calcified biopsy. So such biopsies are difficult to cut with microtome. So first of all, we will have to decalcify those tissue to convert it into a form which is easily sectioned. So the removal of calcium from the hard biopsies is known as decalcification, and different types of the chemicals are used for this purpose, which are known as decalcifying agents like hydrochloric acid, formic acid, acetic acid, and citric acid. Then there is another terminology that is known as bed taking, which is part of the protocol. So the bed should be the size of approximately 4 to 6 millimeter in thickness. These beds are then placed in metal cassettes or capsules, which are then placed in fixatios. Tiny biopsies or small specimen can be wrapped in a filter paper and then put in a cassette and proceeded. So this step is usually for very tiny biopsies. Then we have the dehydration, as the removal of water from the tissue, because we have to impregnate the tissue with the wax. So first of all we will remove water, and the removal of water is known as dehydration. We have two types of water in the tissue, that is the interstitial fluid which is present in the tissue, and some water from the fixatio, because fixatio is also fixatios are also aqueous solution, so they contain also water. So we have to remove water from the tissue. Then we have another step that is known as clearing, and in clearing we will replace the dehydrating agents with the clearing agent that will increase the transparency of the tissue as well. And then the final step in the tissue processing is impregnation or infiltration, in which the clearing agent is replaced by the wax or impregnating media, which may be paraffin wax or some other impregnating media. The next process is embedding, and embedding is meant for providing external support to the tissue so that it can easily be sectioned in the microtome. And then we perform the sectioning, that is also known as microtomy, using a special device that is known as microtome. And the microtome is used to section the tissue according to your protocol. Then these sections are stained and properly taken on the slides. So the most important and commonly used staining in the histotechnique is hematoxylin and eucerin staining. Then there is another terminology that is known as mounting, and it is to preserve and support a stain section for light microscopy. It is mounted on a clear glass slide covered with a thin cover slip. So there are different types of the media which are used for mounting, and those chemicals are known as mounting medias. So this is the basic roadmap, and in the future lecture we will discuss one by one these topics in proper detail. Thank you so much.